term. Like, for example, one of the assumptions that people have, one of the myths, is that you have this is a degenerative brain disease that you'll never recover from, and it will actually generally deteriorate, your condition will generally deteriorate over the course of your life. And that's been so debunked. But, there's been so much research that shows many people actually do fully recover from, they satisfy all the criteria for that label, schizophrenia. And then they get into the health system and, usually put on meds, et cetera. And then many of these people actually make full recoveries. And in fact, in the most optimal circumstances, we found that the magic number seems to be about 85%. So, like, for example, in the open dialogue approach in Finland, which is basically a kind of family therapy type model, systems theory model, they have consistently found about 85% full recovery rates. So they catch people with first episode psychosis, and then they actually intervene with the whole family. They start without any meds at all. They found that, and there's been lots of other research as well, it shows that medication is a double-edged sword. It tends to make people feel better in the short term, but it actually can reduce the likelihood of recovery in the long term. So anyway, this particular model started with no meds, or maybe use a little bit to kind of ease, the suffering of the person, or try to get them off as soon as possible. And they found that 85% would fully recover without, any meds at all. Or if they were put on them, they were put on short term and then were able to come completely off. And then 15% couldn't, they couldn't quite get through it. And then other types of research, like the World Health Organization did a 25-year longitudinal study, 13 countries, and they found that the countries who ironically had the least access to Western psychiatric care, and also there were other factors too. That was a major factor. We're having kind of 75, 70-ish, up to 80% recovery rates spontaneously, full recovery, in the sense that they were no longer having these distressing anomalous experiences. They were functioning fully. So, because this was a 25-year longitudinal study where they went back and looked at the same people who were diagnosed over 25 years. So we have this myth that first of all, nobody recovers, and which is completely false. Or even if you're more optimistic, the myth is maybe a few people recover, but the reality is actually the majority of people would recover given the right, fully recover without, being able to get off all their meds, with the right conditions and the right kind of support. So that's a huge myth that most people still have.